A phobia is a persistent fear of a particular object or situation that causes avoidance, distress, and life interference, per Wendell, 2006. My client is Howard Hughes. My primary diagnosis for this client would be panic disorder or anxiety. I guess the anxiety is causing him to have panic disorder. He appears, after diagnosis, he appears to have a fear of transferring germs via food, drink, or in the restroom. When or if Mr. Hughes believes that he's been exposed to something, he has to go to the restroom. He uses his own soap that he carries with him, washes his hands several times, using a fresh towel to dry himself off, and refuses to touch the doorknob with his bare hands when he leaves the restroom. These are reasons why I would consider him having anxiety and panic disorders. I would definitely rule out obsessive compulsive disorder. He does not exhibit any behavior of repetitive behavior that would be used in order to reduce his anxiety or fears. He does not exhibit any type of recurrent obsessions or compulsions that would interfere with his day-to-day functioning. He's able to function well throughout the day. He just appears to have specific fears or anxieties with certain things that cause him stress and panic attacks. So with psychopharmacological treatment, there are many medications that are available to clients or people who have suffered from panic disorder and anxiety. Unfortunately, a lot of those medications can have side effects, negative side effects, and they are also highly addictive. So as a therapist, although I personally cannot write a prescription for any type of medications for my clients, I can obviously work with a family doctor or a psychiatrist who's able to provide medications for the clients when necessary. I think I would specifically try to offer medications in the SSRI class, as they are less risk of addiction and have been known and suggested to still be able to help the client function, and they're just a safer type of medication for the client. Never would I suggest any type of medication without continued treatment, although unfortunately that's up to the client whether or not they want to continue the treatment and therapy at all. But again, when it comes to psychopharmacological medications, me specifically, I would try to treat the client with a panic disorder or anxiety without using medication, preferably for me, when at all possible, just because of the higher risk of addiction that these medications are for this specific disorder. For family therapy, Howard unfortunately doesn't have any living family that he appears to be close to, so realistically he just has his people that work for him, his employees, that he is semi-close to, and he's not even, it doesn't appear that he opens up to them emotionally or makes that type of connection with them at all. So, however, in speaking with him, we are able to see that his fear of germs and the transferring of germs might be brought on by his mother's behavior towards him when he was a child. We are able to determine that as she would bathe him, she would ask him to spell the word quarantined, and this was a time in which it became kind of embedded in him that germs are bad and to stay away from germs whenever possible, however possible, and unfortunately this is what causes him to have such a great fear going forward of germs. So we can see that as a child, it was brought into his mind how bad these are and how they can affect him in a negative way. And as an adult, it's brought out more in forms of anxiety and distress, so and causing panic attacks. So because his mother is already deceased, there's no way to bring her in and offer a family-based therapy with the two of them to help correct this for them. So personally, I would try to rationalize the situation for him, help him to understand that there is not a need to quarantine anymore. Doctors are more knowledgeable. We have more access to medications and treatments for illnesses, and so there are ways of treating things at this point that he doesn't have to be so fearful of getting germs and catching a sickness or a cold or a flu or something of that nature. When referring to the psychological treatment, my preferred psychological treatment for panic attack or panic disorders and anxiety is the cognitive therapy. This kind of goes back to the rationalization of the situation, reminding the client that times have definitely changed, so doctors know more about illnesses. They are more equipped to treat them in a fashion that can get rid of the illness. They are better knowledge with medications on how to treat them and defeat any type of sickness, most types of sickness that the client could incur. So, and also remind him that he's currently healthy, not because he's avoided germs, because germs are essentially unavoidable, but because he has done well to take care of himself. So it's not to stop washing his hands and being cautious of catching other germs, but just being aware that germs are everywhere. You're going to get them, but obviously he has a good immune system already if he's so healthy right now. In addition to that, we would want to discuss ways of handling situations in which he believes he's contacted germs and it brings on that panic or that anxiety feeling. We would want to discuss what he could do. There was a situation where one of his friends removed a piece of food from his plate and ate it. That doesn't mean that you're not able to eat the rest of the food on your plate. Maybe just avoid that specific area in a situation such as that. For example, if he has french fries and a steak and a friend takes a fry and eats the french fry, don't eat the french fries then. Just continue with the steak and maybe ask the waiter to bring you a side of fries so you can have a fresh plate of fries. Or something like that. There's just ways to reduce the situation by not having to completely avoid the situation. When his friend ate from his plate, he got up and walked away and wasn't able to eat anything after that. That's not completely necessary. When he goes to the bathroom, he doesn't need to carry his own soap with him. He can use the soap that's provided. It's not necessary for him to bring his own soap everywhere he goes when he needs to wash his hands. Also, there was a situation in which he ran out of towels to use and wasn't able to open the door to the restroom, and he waited until another person came into the restroom and the door was open and he could freely escape without touching the doorknob or the door to get out of the restroom. That's not necessary. There are going to be times when you might have to touch something that has germs on it, and to not be fearful of that, to work around that and not be afraid to touch the bathroom door or other situations, to touch other things that might have germs on them. He didn't have a fear of shaking hands, from what I could see, and so that's another way of catching germs, but it wasn't a fear of his. So an important thing for Howard to begin to practice is the diaphragmatic breathing. This will help him to calm down when he feels shortness of breath and the tightness of chest. He can practice this type of breathing to open up the lungs and open up the chest and help to reduce the panic and the anxiety that he may be having in those situations. So practicing that before he is in a situation which he's anxious or panicky, and different times throughout the day until it becomes something more natural for him to use as needed. But not just to utilize it in a situation in which he's already having the attack and the anxiety. He needs to make sure to practice that prior to those types of situations to ensure that he has it down correctly, and that when the situation occurs, he's able to help himself by using the diaphragmatic breathing. And probably the most difficult challenge for him will be entering into those fearful situations and practicing how to reduce the anxiety and reduce the panic disorder as he enters into situations that are more fearful to him. So purposefully placing himself in the position in which he knows he would normally feel the anxiety and the panic will be essential to helping him use the diaphragmatic breathing and to practice the reduction of the anxiety that he's having in those types of situations. Reminding himself the realization of the situation. He's not going to catch a disease just by eating off of a plate that someone else has taken food from. He's not going to die from using the soap in the bathroom. He's not going to catch a disease that can't be taken care of by touching the door on the restroom. So we're going to have to present him in these types of situations and work with him until he's able to be in that type of situation without having the disorder and without having a panic attack. So we would purposefully work on those in therapy sessions, even if it's just using the restroom that's in the main office, by starting in that particular situation, and then maybe taking sessions outside in restaurants or other places to help get him functioning in those areas, in those places, without having the panic attacks or the anxiety. And also assigning him those duties to do on his own when he's not in a therapy session, so that he can practice them by himself, because obviously he's not always going to be in a therapeutic session when he enters into these situations, and needs to learn to experience them and how to power through them by using the breathing and the rationalization techniques, and by just encountering those situations that cause him anxiety and panic disorder.